Hello friends, welcome to another education-based episodes of DLife.in. So I am your host for the today's podcast, myself, Dr. Jasmeet, a certified low-carb nutritionist from DLife. And with me, I have the three more experts from DLife, Shashikant Dayangar, Arun Kumar, and Anup Singh. So welcome all of you.
Thank you. Thank you.
So the today's episode, the title of it is Managing Insulin Levels for Various Metabolic Disorders. We have actually covered most of the metabolic disorders like diabetes, hypertension, PCOS, and fatty liver in our earlier episodes. But today again we are going to talk all about insulin. What insulin is, why it's so important, why we need to look into it, and how often one has to see their insulin levels, and what are the consequences of high insulin levels or hyperinsulinemia, we can say, and which actually leads to insulin resistance. So my first question is to Shashi. Shashi, could you please tell our audience today what actually is insulin resistance? Because what I want you to cover today is because in the low carb world, we believe that type 2 diabetes is the disease of higher insulin. It's not a disease of high blood sugar. So in that relevance, please tell our audience about the insulin resistance.
So, see, I think these are two different factors, insulin resistance and hyperinsulinemia, and probably it is usually confounded with each other. So it is like which comes first, whether it is the egg or chicken. So this story always goes on. So probably the origin is because of energy toxicity, because our cell gets filled in with energy in form of fat. And then that is the time that it refuses to take in more energy. And this is the time that insulin resistance is born, and probably it is also associated with higher insulin level, so that which is called as hyperinsulinemia. So however, we don't know whether hyperinsulinemia comes first or insulin resistance. These things keeps on debating. But however, it has a very central role in all the modern chronic diseases, like whether it is obesity, PCOS, fatty liver, diabetes, bone and joint disorder, Alzheimer's, dementia, various mental disorders, and possibly has some role in cancer also. So while it has a central role in many of the modern chronic disease, however, what will be of interest is like diabetes. Like there is a natural history of diabetes. What happens is initially insulin level actually rises, and then after some time your blood sugar rises, and probably it is during this time diabetes gets diagnosed. And after this, what happens is the insulin level still will go up, and then it will start coming down, and blood sugar level will go up. And I think it's okay if I show one presentation which will actually help. This is just a single chart which will show that. And you can see that the first one which is given is obesity, impaired fasting glucose, diabetes. So this is in this stage is probably where the blood sugar is higher and insulin resistance, and probably insulin is also higher. And if things are not controlled, insulin resistance will remain and insulin level will go down and blood sugar will keep on increasing. It's a very nice chart. But what happens is it is automatically assumed that our insulin levels are low while the blood sugars are high. And the treatment given is probably to release more insulin already in a hyperinsulinemic stage. We have seen in many of the cases where when we test the insulin level, the diabetics have adequate insulin level and they are drugged with a drug which may release insulin also. But nowadays, due to newer options are available. So people are given something which will remove excess sugar in the blood, or of course the mainstay metformin is always there, which improves insulin resistance. So this is how it is. And at the time of diagnosis, if we measure insulin level and we take a remedial action like anything which will lower down this insulin level, like a low carbohydrate diet, so we can actually address the whole issue without actually drugging the patient. Yeah, over to you, Jasmine.
So I would like to add one thing. So for the audience, I just want to mention that here we are not there to vilify insulin. Insulin, it's a life-saving hormone. If you don't have it, one can die. Okay. So we are just here to tell you if the hormone insulin, if the levels remain elevated for the longer period of time, what are the consequences of the high levels of the insulin? Okay. So, like Shashi already mentioned, that type 2 diabetes, which is a disease of hyperinsulinemia or insulin resistance, if somebody like Anup Singh, I will ask the next question for you, it will be for you. Like Anup Singh, he diagnosed in 2010, I think.
11.
11. Okay. So like he diagnosed with the diabetes in 2011, but at that time he was already suffering from other complications like hearing loss, maybe some other health issues as well, which at that time he could not correlate with the insulin resistance. But now we are trying to understand that the many health issues which are now related with the insulin. So if somebody can, whenever we go for a regular blood work, if you ask your doctor that you want to do a regular blood work, so what he will do? He will do your blood sugar, HbA1c, or maybe your lipid profile. He just check your cholesterol or LDL cholesterol or your liver function test or something like kidney function test. But unfortunately, nobody ever looked into the insulin. So like Anup Singh, he diagnosed in 2011. If he could have diagnosed with the diabetes, I think decade before 2011, if he looked into his insulin levels. So in Anup Singh, could you tell, the earlier we diagnose, the more are the chances of reversal with the low carbohydrate or ketogenic diets? Because in I think you are the only member in on D Life which I think that already reversed your diabetes, but others like Shashi and Arun Kumar are there in re-emission phase. So could you please elaborate more on this?
See, Jasmeet, basically, I will talk in Hindi and English because audience India का ही है ज़्यादातर, है ना? And Nick can understand Hindi completely.
Yeah, that would be better.
Yeah.
Everybody here
So,
to you.
देखो मेरा diagnosis जो है before that, I think if I remember correctly, November 2010 मैं हुआ क्या था, ये डिनर लेते समय suddenly I lost my voice and that I freaked out. उसको आपको विश्वास नहीं होगा, 24 घंटे लगे थे to get my voice back and no medicines taken, nothing. वो बायोकेमिक कोई दोस्त था, वो बोला ये गोली खाते रहो 15 मिनट में, वो करता रहा, but ultimately I could get my voice back. और आज ये हालत है, if I shout ऐसे let's say अगर मैं 10-15 मिनट चिल्ला दूं ना तो फिर मेरा गला बैठ जाता है. I cannot shout at top of my voice. तो नवंबर 2010 में तो ये हुआ. उसके बाद क्या हुआ कि why I went for checkup was कि मेरे को bumps आने लगे थे, especially this temple area. तो वो क्या है, वो I started looking up literature. तो उसमें एक जो terrifying चीज थी, that was GCA, giant cell artery, जो अरुण सर और शशि बता पाएंगे. I don't remember those Greek derived terms very correctly. तो मैं डॉक्टर के पास, अच्छा उसके पहले फिर क्या हुआ, फ्रेंड एक है, उसकी सिस्टर डॉक्टर है, उससे पूछा, बोला अरे आप घबराओ नहीं, यू आर जस्ट दिस इज नॉट दैट. बट शी चेक माय बीपी, इट वाज ऑलरेडी स्टेज 1 बोल रहे जिसको 140/90 और समथिंग. तो बोले आप जो है इस पे कंट्रोल करो, नहीं तो दिक्कत होगी. In February 2011, that is the time when I formally went to a doctor. और मैंने बोला भाई I am fearing this, so kindly get me tested for HSCRP because उससे एक है या आप deduce कर सकते हो या deduce कर सकते हो whether it is there or not. So he also laughed. He said नहीं, why are you so paranoid. मैं कहा नहीं, मेरे को आप ये चेक कर दो, बाकी जो टेस्ट लिखना आप लिख दो. तो ही नॉर्मल जो होता है जैसा आपने बोला फास्टिंग ब्लड शुगर, पीपी, लिवर प्रोफाइल, HSCRP also he did. उसमें जो है फर्स्ट रीडिंग माय फास्टिंग वाज 129 आई थिंक, इफ आई रिमेम्बर करेक्टली, और PPBS वाज 220 प्लस, और मेरा वेट था उस समय 83. on a height of 5'8". I never used to walk. मैं तो मतलब I was a typical sedentary person. वो आज भी हूँ. और फिर हुआ क्या कि ये जो टिनिटिस का बात कर रहे हो ना आप, ये it was so severe that I could not sleep. मतलब वो हाई पिच साउंड कंटिन्यूस 24/7. आप सोने जाओ तो नींद आने में भी जो है वो 15-20 मिनट लगते थे. तो मैं क्या करता था, पैर गीला करता था, एसी के सामने रखता था. अगर 15 मिनट में नींद आ गई तब तो सो गया, नहीं तो फिर से वही रिपीट करता. एनीवे वो हुआ. उसके बाद चलने के लिए जब बोला तो यू आई यूज्ड टू गेट क्लॉडिकेशन लोअर लिम्ब पे, ये काफ के नीचे जो है ना दोनों साइड. चलता था तो barely, I used to walk a kilometer. Whole thing used to get stiff, red and severe pain. इतना पेन होता था कि मैं एक स्टेप नहीं चल पाता था उसको. तो ये सब होता रहा. उसके बाद तो जो है yes, as you said कि जितना जल्दी डायग्नोज होगा उतना आप you can pull along without medicine and be relaxed on diet. अब उस समय तो मेरा इंसुलिन टेस्ट नहीं हुआ था, बट 9 years, I think 9 years later I tested my fasting insulin. So that was around 8.7 or 8.8. कॉपी बुक परफेक्शन नहीं था, बट आई कंसिडर इट इज ओके. तो अब जैसे अरुण सर का है, उनकी 25 साल की हिस्ट्री थी, ठीक है. वो जितना मैं रिलैक्स्ड रहता हूँ ना उतना नहीं रह सकते. ही इज ऑन स्ट्रिक्ट कीटो, whereas I am on you can say low carb or relaxed low carb, it depends on the day.
Yeah.
And अब जैसे है आजकल जो है I have to walk a lot for some reason, so I can tolerate more carbs. ठीक है, तो ये है.
So it's actually the carb tolerance vary from a person to person. It depends on your history and many other things. How much the damage has already been done due to the high blood sugar levels or the high insulin levels. So yes, Anu.
हाँ, tinnitus पे जो था, I missed one thing. Now it is almost zero.
Okay, your tinnitus is gone.
Yeah, only thing, hearing loss is a consequence of prolonged tinnitus. कभी ना कभी वो आपको it will affect you.
Okay.
अभी क्या है, अभी only thing I can hear is my heart pumping. ठीक है, I can count my heartbeat without keeping my hand on my pulse. But किसी दिन अगर मैंने ज्यादा ले लिया, मीठा ले लिया या कुछ ले लिया ना, immediately it strikes back. That's high pitched running faucet, जो typical उसका symptom है ना, high pitched running faucet. लगेगा आपको कि continuous जो है नाली से पानी जा रहा है. तो जो आवाज आती है ना, नाली सिंक की जो आवाज आती है कंटिन्यूअस, यही बोलना था खाली tinnitus पे.
Okay. So Arun Kumar, now my next question is for you. Like all of us who are here, we know that we prioritize that we should look into the insulin levels. So we avoid the foods which are insulin spiking. But whenever it comes to obesity, fat loss or weight loss, there are many people believe that calorie counting comes in picture. So could you tell me what are your thoughts, or do you take both of them together like insulin spiking plus calories, or you think that calories doesn't play any role?
Jasmeet, ऐसा है कि insulin resistance. Just as Sasi has elaborated it, but I would like to put some more points here. In my case also, because I have more than 25 years of diabetic history. So when I have been diagnosed at that time, this fasting insulin test, even HbA1c test was not available in my city. So I don't know what was at that time my HbA1c. But glucose, fasting and TP both are elevated. Doctor, what I say, my Indo has prescribed me some insulin secreting drugs, SU drugs, metformin, and then pioglitazone also. That actually causes a lot of harm. What happens just means when your blood glucose is high in the serum and insulin is trying to put glucose inside the cell, and due to the insulin resistance of the cell, it is not coming. Then brain signals to beta cells to produce more insulin. and beta cell produces more insulin. So this cycle goes on. And when you put some SU drug or insulin secretory drug, it will causing further damage to the beta cells because that pressures the beta cells to produce more insulin. What happens in the consequences, the cycle will go on, go on, go on, and after a few years, your beta cell will give up. You okay? Now I am dying, I cannot produce more insulin. That is the stage when even if you are on the low carb diet, slightly carbohydrate will raise your blood sugar. This is one aspect. Another is when you have insulin resistance. Insulin is, not only that it is lowering the blood glucose, but it is also responsible for the fat deposition in the cell, adipose tissue. So when you are having high insulin in the blood, you cannot lose weight because this insulin will not allow fat cells to release the fat.
Yeah.
And what happens? So you go on doing your exercises and whatever it is, but it is difficult to set the weight unless until you reduce your insulin level in the blood. And as we know that we thought that insulin level should not be go more than 6 in the fasting insulin, and PP depends on the what you are taking, 25 to 30. If your insulin level is above that, you will not able to set your uh, obesity. You cannot reduce your obesity. It is very difficult. And where our medical community or mainstream treatment does wrong, they are prescribing to secrete more insulin, and more insulin will not never allow you to lose your weight. That is the way. Yeah.
Okay. Thank you, Arun Kumar.
I just wanted to add in the Anup Singh statement. I was going through some study that high insulin level or hyperinsulinemia is also causing the muscle weakness. This causing the muscle weakness, and your tinnitus is also caused due to the muscle weakness of the ear.
Yeah.
So in that case, it will be difficult to revert back. Whatever the damage is done, which is not repairable, which is not you can repair that. So that is done. That is cannot be recovered. But tinnitus is also causing due to the insulin resistance due to this fact. Your eardrum will be weakened, and when it is weakened, how can it? Although maybe the Anup Singh has a different thing, but what I will read in some of the studies, this causing the tinnitus, this causing the permanent damage to the ear, not only ear but other organ also, but ear is also one of them. And other cases also there. In my experiences, when I have been diagnosed diabetes, at that time such researches were not available. I have also the severe cervical spondylitis. I every after week or 10 days, cervical spondylitis attack has come, and even I cannot take side flip or this side flip. It is, the whole body is winning, and I am feeling typical vertigo. So sometimes I have to vomit also in that case. When I adapted the low carb, suddenly I noticed one day it is vanished. There is no spondylitis, no vertigo, nothing like this. So these are all related to the insulin resistance. This
Yes,
is my
Anup, would you like to add something?
Yeah, Arun sir ने अभी muscular weakness का बोला ना. I forgot to add one point. I was suffering from what doctors called mastication epiphora. ठीक है, मैं खाना खाने बैठता था तो हाथ में एक रुमाल रहती थी. The moment I started chewing, tears used to roll down continuously. तो डॉक्टर से पूछा था ऑप्थेल से, so he said no, this is permanent damage to some nerve and there is no solution, it will continue for life. आज की ये हालत है. It took around 8 or 9 months if I remember correctly then, कि suddenly सब कुछ गायब हो गया, कोई आंसू नहीं निकलता है, खाना कितना भी कूच के खाओ, peanuts and nuts I still can chew raw, कोई आंसू नहीं निकलता है. बट शुरू में ये हालत थी कि रुमाल लेके बैठना पड़ता है, continuous. It used to, tears used to roll.
So let me just summarize. Actually, what the people wanted to say that because insulin affects each and every cell of our body, because literally each and every cell of our body have insulin receptors. So insulin is actually like a dictator, because as Arun mentioned, calories do come into picture, but later on. The first thing is if the insulin levels are high, because if insulin is high, it's like a dictator which tells your fat cells to either store it as a fat or use it for immediate energy source. It depends, because whenever your insulin is high, the another hormone glucagon will not come into picture, because insulin is for the fat state, and for the fasting state, if you really want to use the energy which is stored here, whenever we talk about energy, like Shashi also mentioned in his first answer about energy and fat, here energy, whenever we talk about fat, it's not the fat, the dietary fat, the glucose or the starches or the sugar that you are taking, that can also be converted to fat. Okay, it's not the fat means the fat you are taking. So the glucose that you are taking or the sugar, everything, the starchy food, that also gets converted to fat. So what the people want to say is like, now if insulin is high, that it will dictate if you want to store the fat or you want to lose the fat. Okay, the first thing with the low, why we promote low carb? Because low carb helps us to normalize or balance the insulin hormone. Once the insulin level is balanced, everything gets back to the track. So my next question to Shashi is like, Shashi, now we're talking about obesity. Whenever we talk about obesity, most of the people, they still believe that metabolic rate is important. They say everybody Google how I can increase my basal metabolic rate. But what we believe is here also insulin plays a major role. We believe that metabolic flexibility is more important. How easily a person can shift from the fuel glucose to the fuel fat. So how insulin comes into picture. So how one can increase their metabolic flexibility or easy to lose weight. Shashi, you are mute. Please unmute yourself.
So, so metabolic flexibility is something which I'll say for most people may not be very easy to achieve unless someone goes on a low carb. So
Yeah.
people, once they go into low carb, then the shift will be very, very easy. Otherwise, it is very difficult. And metabolic rate, yes, initially during the earlier phase of life, people have very high metabolic rate, and then they can burn anything they want. But as we age, this metabolic rate does come down, and there is a time where the insulin also rises due to the wrong food we are having, either high refined carbohydrate or the seed oils uniquely, which can also cause insulin resistance on its own. So if people go low carb, probably they can gain this advantage of being metabolic flexibility. Otherwise, it is very difficult. Yeah.
So metabolic flexibility, why are we talking about metabolic flexibility here? Because everybody want to lose their fat. Everybody want to get their ideal body weight. So it's only possible if you shift to a diet that can normalize your insulin levels, because insulin inhibit the lipolysis. Okay, lipolysis means you can't have access to the fat that is stored in your body. So, so after this, I think we should now talk a bit about hypertension as well, because we have to cover all the metabolic disorders. And there are many cases. I think, Shashi, you were also suffering from hypertension.
No. I never had
Okay.
hypertension. So, but I don't mind speaking a minute on this, because
Okay. So, but
hypertension is
how,
very strongly linked with insulin resistance, because as the insulin level rises, it leads to retention of sodium in water, and it also activates the RAS system, renin, angiotensin, aldosterone system, sympathetic nervous system. So all this leads to the retention of sodium in water, leading to rise in blood pressure. And we have seen in our forum, we have quite a few cases where we could remove the medication, or rather de-prescribe medication. In my own case, like one of my own friend used to have 4 big medicines, and we could get off all these meds within a matter of 3 months. So, and few other cases we have had in the forum among our family and friends. So it is very easy to get off BP medicine, provided we follow a very strict low carb diet, and probably low carb in some and keto in other. So that depends upon the metabolic condition which we have. So some will respond to low carb, some request keto. Yeah, Arun Kumar.
Rather, it is depending on your age. Because if you are aged person, then metabolic rate is naturally reduced. So at that time, you need to have a very low carb, say 20 gram or 25 gram carb per day is sufficient for that. But it is where you are very correct that hypertension is very clearly linked to the insulin resistance, very clearly linked to the insulin resistance and hyperinsulinemia. Rather, you can say the other metabolic syndromes like obesity. I am very firm, I believe that obesity and hypertension go hand in hand. Like, and other cases also, but other aspects also. But in case of hypertension, I have seen many of the patients or many cases when we reduce the carb intake of the patient. So slowly, hypertension also reduced, and he is off from the all hypertension medicine. So it is very clearly indicating that hypertension is in interlinked with the your carb intake or with the insulin resistance. So I feel that when your insulin resistance is reduced, your level of serum insulin will reduce, your hypertension will be also. Because when your sodium retention will be high, so your hypertension will be also high, and insulin does that. Yes.
So let me also add to it that I believe that majority of the cases can be resolved, but there will be still some cases where it is difficult and will require medication. So because it's a multiple approach one, so it is possible that I will say that maybe 75% can be resolved, maybe 25% other will have some other secondary cause which needs to be addressed. So
does
it
it
not
mean the damage? It depends on the damage which has already been done.
Plus, there could be some other etiology which is affected.
Actually, endothelial dysfunction is very high. Endothelial dysfunction is very high. In that case, it will be very difficult to reduce the medication because at that time, blood vessels are not responding with even with the reduction of the insulin or serum insulin. So in that case, medication is required for the dilate the blood vessel. If other like LVF, other left ventricular atrophy, so in that case also it is very difficult to reduce the medication in that way. Very few cases I have seen. Recently, I think in one of the forum, somebody else I saw. So he has a left ventricle thickness or atrophy. In that case also, we have reduced the medication, but not all. One or two medications he has to take, like this calcium channel blocker he has to take. Yes, that's right.
Yeah, one more thing. Yes,
I will take half a minute more. Sorry.
Yes.
We are
No, it's okay.
this topic because since Arun Kumar has mentioned, recently I have a case where the left ventricular hypertrophy actually disappeared after 4 months. 20 years, 2 decades history of LVH just disappeared. So we are yet to get the lab report, the 2D echo for that. So once it comes, I will share with all. 2 decades of LVH disappeared on a low carb diet after 4 months. Yeah,
so you put that person on a keto or just a low carb?
No, on a ketogenic diet, low carb ketogenic vegetarian diet. I'll share. Yeah.
Oh, it's a vegetarian. Oh, that's a difficult case for you. Yes, Anu.
Yeah, as Shashi mentioned, forum pe we have a typical case of father of one of the members who landed in ER, ICU, unconscious, and had 90-70 blockage.
Yeah, I remember that.
Yeah, so just to add to that, the disappearance of LVH or whatever, ये भी एक case है, and 2D echo test, I think it took around 2.5 years. Everything is normal. Only one was stented. Doctors were saying कि आप तीनों में stent लगा लो, कर लो, वो नहीं किया. And as a heart attack patient, उसके बेटे ने अपने डैडी को जो है लो कार्ब पे रखा, which nobody will do in this world after getting a heart attack, ठीक है? And it took 2 to 3 years. सब कुछ normal है अभी, echo test normal, stress test normal, everything is normal.
Anup, I would like to, yes.
Shashi, I remember one of your close, not friend, also member of our forum. Recently he showed me his reports. 2D. Do you remember that? Something Ashish or something.
I don't recall.
He actually sent me the report.
Okay.
Where
Acha,
the
Ashish, yeah.
left
Yeah,
ventricle
Ashish.
hypertrophy was there. I asked him to go for this echo 2D echo, and the report come to me, and then I conclude that it is the left ventricle hypertrophy. So you have to reduce on the carb.
Yeah.
I think he will also come to respond within 2 to 3 months. But he is not very strict keto.
No, it's a different case. We'll get back on.
Okay.
Actually, the thing is, in the present world, even though the people are now well aware about the low carbohydrate and the benefits which one can acquire from the low carbohydrate diet, but still I have seen that there are many people who are promoting the low fat diet, low protein diet, and even the low salt diet. And the low salt diet in itself can be the cause of insulin resistance because people are not taking enough salt, and then the insulin level rises to retain the salt because sodium is essential for us, and gradually a person becomes hyperinsulinemic and then the insulin resistant. And now when it comes to low fat, everybody knows that people are afraid of cholesterol and all because they believe that it is related with the atherosclerosis. And another thing is low protein. Why? Because I have seen the many videos are coming day by day about the low protein diet, and what even the doctors, the very renowned doctors, they are speaking about the low protein diets. So of course the people, it's really very much complicated for really a layman, to really believe that where should they move, low carb, low protein, or low fat, where they should really move. So with the low protein diet, what the people say is, because when we eat a high protein diet, there is a lot of load on the kidneys. And I don't know why the people say like this, because but we have already presented many cases like this, that people have improved their creatinine, their GFR on a low carbohydrate, where we really promote a moderate to high amount of protein. So Shashi, could you please talk a bit about this?
I think I really don't know what to talk on this.
Like,
it is totally a myth. It is totally a myth. In fact, recently I had a case where creatinine was 1.3 and the person was on abysmally low protein diet. So we put them on a low carb ketogenic diet, and protein was around 1 gram per kg body weight. The creatinine actually came down from 1.3 to 1. eGFR improved from around 60 to around 77. This is within a matter of just 2.5 months. Just 2.5. Person was on insulin. We took off insulin within 2 days. So all this is, it is totally a mythology that protein damages kidney and all. I think this stems from somewhere the people from gym dying or something, and then they relate to, they are relating to high protein diet, whereas they don't understand that people over there, they use steroids, they use performance enhancing drugs, and it happens. Or maybe it is also due to that, because more nitrogen is released in urine. So automatically they assume that if it is more nitrogen, that means kidney is damaged. Okay, so it is totally myth. There is absolute no truth. Yeah, Anup.
There are a lot of studies also. Yeah, there's a lot of studies also which clearly indicate if you are taking the high protein diet, that is minimum say about 90 gram, 100 gram per day, or 1 gram or per kg body weight, nothing will happen to your kidney. Your kidney will be as good as it is around there.
See, it has been proven in bodybuilders up to 3.5 gram per kg body weight is very safe. So we are not going to take so much. We go at the most 1.5 gram per kg body weight, which is, yeah, if a person is renally compromised, it's a different thing. We may need to be careful, but for normal kidney function, absolutely is not the truth. Yeah, Anup.
Yeah, I will, answer this from a totally different perspective. 3 macros, 3 energy-giving macros: carbohydrate, fat, and protein. Okay. For decades, fat has been vilified. अब चूंकि लो कार्ब और मीडियम प्रोटीन हाई फैट पे थोड़ा पॉपुलैरिटी बढ़ रहा है, तो नाउ दे आर टारगेटिंग प्रोटीन. और इजीएस्ट वे टू सेल जंक फूड और हाई कार्ब or packaged, atta coming from General Mills or all these big names, is to vilify fat and protein. carbohydrate will automatically sell. It is all about food industry screwing up health world over by these, I would call them junk studies. आप स्टडी देखो ना, एक स्टडी करके आप कंक्लूड कर लो, नहीं करेंगे वो, जहाँ पे उनका रिजल्ट फेवरेबल नहीं है, रिजल्ट्स आर गुड बट वी नीड अ लार्जर पॉपुलेशन, लार्जर स्टडी. This larger population, larger study has been continuing since last, I think, 60 or 70 years, and it will never end for next 100 years. तो मेरा कहने का मतलब है आप एक स्टडी पकड़ो, एक, ठीक है. और मैंने जैसे पकड़ा था, there was one Swedish study, one, जिसमें सीधा लिखा हुआ था at 20% carbohydrate, saturated fat has got no relation with CVD. End of the story.
Yeah.
अब उसमें अगर मैं काउंटर ढूंढूंगा तो कुछ और मिलेगा, then I'll be confused myself and I'll be confusing others also. अब हुआ क्या, मैं तो चला गया ना, 12 साल से जिंदा हूँ, ठीक है, मरा नहीं, लिपिड इज फाइन, एवरीथिंग इज फाइन, नो हार्ट अटैक, जबकि मेरे जेनेटिकली आई एम प्रोन टू कार्डियक इवेंट्स. My father had 2 attacks at the age of 37 within 3 months. My grandfather died of heart attack at 57. ठीक है, फैमिली में हिस्ट्री है पूरी हार्ट अटैक की. आई एम से डिस्पाइट बीइंग अ डायबिटिक, बट यस, ऑन अ हायर फैट लो कार्ब डाइट. ये फैट और प्रोटीन से डरने का जरूरत नहीं है. एज शशि सेड, रीनली कॉम्प्रोमाइज्ड, you have already hit a wall, so please don't expect any miracles. But जैसे शशि ने बताया 1.3 से 1 आया, before we started D-Live, दूसरे फोरम पे जहाँ हम सब मिले थे, इनफैक्ट दैट पर्सन इज हियर ऑन दिस फोरम ऑल्सो, उसका जो क्रिएटिनिन था इट वाज 2.27, ठीक है, 2.27, 2.9, और डॉक्टर्स हैड सेड कि यू आर नाउ हेडिंग टुवर्ड्स डायलिसिस वेरी सून. अब वो मरता क्या नहीं करता, उसने बोला ठीक है, तो चले ही गए ना. ही ट्राइड लो कार्ब, एंड यू वोंट बिलीव, उसने लास्ट जो पोस्ट किया था, अपडेट किया था आफ्टर 4 इयर्स, आफ्टर 4 इयर्स ऑफ लो कार्ब, हिज क्रिएटिनिन वाज रनिंग 1.7, 1.8. 2.3 से 1.8 अगर वो 4 साल मेंटेन किया है, बिकॉज ऑफ लो कार्ब, whatever you call higher protein, medium protein, because ultimately एनर्जी चाहिए. आप कार्बोहाइड्रेट कम कर रहे हो तो फैट प्रोटीन बढ़ेगा, प्रोटीन एक लिमिट से ज्यादा बढ़ा नहीं पाओगे तो अल्टीमेटली फैट ही सबसे ज्यादा बढ़ेगा. So don't fear fat, don't fear protein. Simple.
I'm also quoting my example since last 7 years, say 2015 के मार्च से पकड़ लो until today. Every day I am consuming not less than 130 to 140 grams saturated fat every day. Butter, ghee, and other things. At least 3 to 4 eggs. तो मेरा कहाँ हार्ट अटैक हो रहा है? सिंपल चीज है. मुझे तो आज तक मेरा ट्राइग्लिसराइड 94, HDL 95,
वेरी गुड,
एंड कोलेस्ट्रॉल 321. मेरे को बोला मेरे फ्रेंड जो डॉक्टर है, बोला तुमको हार्ट अटैक होगा. अब बोला आज चैलेंज ही हो, अगर मेरे को हार्ट अटैक हो गया ना, 1 लाख रुपया मैं तुमको दूंगा इलाज के अलावा.
सर मुझे डॉक्टर्स ने बोला था you will have multiple organ failures very soon. The moment I talked low carb,
these are all bullshits. These are all nonsense talking, and as Anup said, it is the myth spread by junk food industry. Food industry. वो कहाँ से है? अपने इंडिया में भी जंक फूड काफी चलता है, वो फास्ट फूड चलता है, तो लोग का कैसे टिकेगा? एंड जंक फूड इज मेनली कंसिस्ट ऑफ द कार्बोहाइड्रेट, फैट एंड सॉल्ट एंड शुगर. तो शुगर और कार्बोहाइड्रेट बेचने के लिए तो उनको चाहिए ना, दे हैव टू विलिफाई द फैट एंड प्रोटीन. अगर आप प्रोटीन डाइट ले लोगे तो आपको स्नैकिंग की जरूरत नहीं पड़ेगी. हाई फैट डाइट लोगे तो आपको सेकंड टाइम स्नैक की जरूरत नहीं पड़ेगी. एंड इफ यू डोंट नीड दिस स्नैकिंग, देन वेयर दे विल सेल द फूड, their products. That is the way why they are verifying the protein and fat.
Low fat nonsense.
Low fat
जो है ना, there's a company in America called Campbell Soup. I think it came from there. वो सूप्स बनाते थे प्री-पैकेज, कैम्पबेल सूप. वहां से वो मार्केट करने के लिए जो है उसको एक बहुत ही ज्यादा, आई थिंक गैरी टॉप्स का कोई पेपर है, पॉलिटिकल साइंस ऑफ सॉल्ट और समथिंग, उसमें क्लियरली ये सारी चीजें दी हुई है. ये फूड इंडस्ट्री इज बेसिकली रिस्पॉन्सिबल फॉर ऑल दीज जंक स्टडीज, स्पॉन्सर्ड स्टडीज बेसिकली. वो चाहे अंडर द टेबल स्पॉन्सर करे, चाहे ओवर द टेबल करे, करते हैं.
If you have not what to disclose it here, But it is fact that Coke company, Coca-Cola company, or Pepsi, they are giving lot of money to different institutions to say that their Coke is.
Arun, I think I should get to the next point because we are already approaching 5 o'clock. So the next point that I would like to, now discuss is about infertility in men and women. So we already have a case on forum as well, and personally also I had a case 2 to 3 PCOS case, and PCOS, which is the major cause nowadays of infertility in women, and that also relates with the high insulin levels or hyperinsulinemia, because the high insulin, it inhibits the conversion of the hormone testosterone to estrogen. So due to which the women are suffering from the various symptoms like irregularities in their periods, some on and off, like 8 to 9 cycles per year. And they have another issue. Some ladies have a cyst in their ovaries, like male pattern baldness and facial hair. So all of these things we have already seen on forum also. So Anup Singh, you can mention about that, and then we will come to the infertility in men. And Shashikant, thank you. You will talk about infertility in men. So Anup.
PCOS classical case, Pragya Chaturvedi, aged 23 when diagnosed, and she was also running high blood sugar. Moment she switched to low carb, I think all, even her blood sugars were normal, and PCOS is gone. ये मतलब actual case है.
Even I had 2 cases of PCOS, and I think in 2 to 3 months the periods come back, and even the facial hairs, they just go automatically. She was planning to do some laser treatment, but within 3 to 4 months everything is gone. And even I don't know, I don't agree with the the male pattern baldness, because there are different factors in hair loss. So hair loss problem is still there. So, but the other symptoms, they are already gone. So Shashi, could you talk about infertility in man, how it is related with the high insulin or insulin resistance?
Yeah, Jasmeet. So see, first of all, even in female, see, other than the PCOS part, if you really see the excess insulin actually affects the small follicles and something called the theca cells.
Yeah,
so
yeah.
it actually disturbs the whole the whole luteinizing phase, and hence it leads to something called as anovulation. So this is in female. So when it comes to male, again, not only it reduces testosterone, but actually it reduces the semen quality as well as the number of sperm counts also. So in a way, if you really say to make the matter very simplified, hyperinsulinemia equally affects both male as well as in female. So as we know the other fact also, just straying away for the infertility part, in female, it increases testosterone. In male, it actually reduces testosterone. So this is the strange way in which hyperinsulinemia affects both male as well as female.
Yeah,
and I think there are multiple references on this.
In men, it also causes ED. The insulin resistance also causing ED. So that is also affecting the male reproductive system.
And many people nowadays are suffering from these kind of issues, and I think nobody tell them about the insulin resistance, that there is any correlation between such kind of issues with another metabolic disorders. So the next thing now I would like to talk about osteopenia. So osteopenia, which is a problem related with the bones. So the bones, they don't grow, like, because there are 2 types of cells in our bones. One is osteoclast and another are osteoblasts. The osteoblasts, which are responsible for the repair and growth of the bones, and osteoclasts, which are responsible for, like, they damage the bones. But in case of the insulin resistant people, the osteoblast process, it suddenly stops. And people are taking vitamin D. So I just read that the vitamin D is helping with the osteopenia. So why it's helping? Because vitamin D is improving the insulin sensitivity of the osteoblast cells. So that's how it is related. And now another issue is osteoarthritis, which is related with the joints. So, and many people, they just think about the inflammation in the joints is related with the autoimmune problem, but it's not always the autoimmune problem. It's in most of the people, it's due to the insulin resistance. So, Shashi, could you talk about the osteoarthritis, which is
Yeah.
a problem related with the joints particularly?
Yeah. Now, to a small correction here, the rheumatoid arthritis is something which is where the autoimmune condition comes.
Yeah.
Where osteoarthritis, it is, people think it is due to aging. People
Yeah.
think it's maybe due to some mechanical injury, maybe due to running and all. Very few actually correlate with insulin resistance, hyperinsulinemia, as well as raised blood sugar. In fact, hyperinsulinemia is independently correlated with the damage of cartilage. So the actual biochemical process is quite big, and which we don't want to talk right now. But then suffice to say that there are hundreds and thousands of reports, clinical studies or review articles which actually suggest that insulin resistance slash hyperinsulinemia slash blood sugar elevated or dysregulated blood sugar is actually involved in osteoarthritis. In fact, I have, or rather I used to suffer, or I used to have osteoarthritis in my left knee. And this was just diagnosed 6 months after I got diagnosis of diabetes. And by following a low-carb ketogenic diet, plus some other supplements, and now my osteoarthritis is resolved. I know that it is still there. Maybe if I exert too much, it can come. But somewhere there is an inflammation involved. That inflammation is gone. And probably that the healing is going to take a long time. I mean, there is no way where you can regenerate the cartilage very easily. That's what I keep reading. Maybe there are some treatment like sending some echoes or something, some sound vibration, but I really don't know. But then as far as I am concerned, I can walk and I can run, I can climb stairs very fast also. So it is almost, I will say that osteoarthritis in my left knee is almost resolved with a low-carb ketogenic diet, keeping a very low insulin and keeping a very low HbA1c. Yeah.
Actually, it's, I think doctors, they know about this, that this is somehow related with the insulin or the high levels of insulin. That's why they always tell the people that this is osteoarthritis, that it is just the wear and tear that has happened due to your weight. So they directly come to the weight. They never talk about the insulin. So the low down your insulin, they just tell that, okay, just walk. If they walk, what will happen? There will be more wear and tear. They don't come to the root cause. The root cause is the high insulin levels. So this is the issue.
Yeah, actually, I would like to just add one more thing here. That osteoarthritis, you talked about that. I am also telling that rheumatoid arthritis, which is otherwise known that it is attack of the immune cells. But recently I was reading, say 1 year back, actually I exactly not recollecting the name of the author, but he very clearly mentioned that due to the mitochondrial dysfunction, immune attacks the joints in different places in a small joint, and that causing the rheumatoid arthritis. In other rheumatoid immune disorder also is hyperinsulinemia, also reason for that, because this hyperinsulinemia leads to the mitochondrial dysfunction. So this is the way. And to my experience also, my wife has also the rheumatoid arthritis, and not much, but since last 1 year she is also low carb diet. Not very strictly, but she actually relieved from all rheumatoid arthritis. Their fingers were very difficult to move. Now she is moving very clearly. And not only study, but I also suggest to some other persons who are having the rheumatoid arthritis, I ask him to reduce your carb intake and you will find few. 2-3% reported that sir, abhi to kuch theek hua, but I don't know.
What happens when we do low carb, why it is helping in rheumatoid arthritis? Because when we do low carb, we are actually eliminating all the inflammatory foods. So that's the reason that it's helping in the rheumatoid arthritis as well.
Yeah, as well eliminating wheat. Wheat can possibly cause autoimmune condition, and as Nick mentioned just now in DM, so probably even vegetable oils. So there is one more cause.
Yeah.
The kind of oils which we use may be also causing, and basically we are in an elimination diet. So we eliminate all these inflammatory or autoimmune causing foods. Yeah.
So would you like to add something, Arun Kumar, to this?
No, that's all. Actually, in osteoarthritis or even in the other joint problem, it is well-known fact that it is related to the hyperinsulinemia or insulin resistance, which is also evident from the many of the cases also. We have seen, you also seen. So not only that, but other aspect also, in other things also, which is also related with like cervical spondylitis. The problem with your cervical vertebrae is also related with the insulin. I told you that few years back, I have very serious cervical spondylitis. And when I adopted a low carb diet, it is already vanished. It is really due to the low insulin level of my blood. And that is not causing further. I'm okay. I don't have any symptoms of the cervical spondylitis. That's what I wanted to say. Yes.
So even I have cervical spondylitis. We resolved now. Yeah.
Okay, so with low carb, it's resolved. Okay, great.
It is still there. It is under control. I don't require any medication, no pain.
Okay, good. So the last one, I would like to talk about digestive issues now. So I will start with the GERD, the reflux, gastroesophageal reflux disorder. So many people come to us with the digestive issues and specifically acidity or heartburn. So these kind of symptoms, the people, they complain. And even on forum also, even the people, if they come for the diabetes, hypertension or any other health issues, they also have GERD. So somehow GERD is also related with the high insulin levels. There are there are data available, and one literature just I have looked right now. So they were saying when they just observe the different people who are having the chronic GERD issues. So about 92% of them, they were having the high insulin levels. And about 82% of them were having the high blood sugar levels as well. So, Anup Singh, could you please talk a bit about this? If you had in your mind any case of GERD and that also have insulin resistance or high insulin levels on forum?
Just with GERD, I would only quote two cases which were extreme. बाकी तो सबको है, ठीक है? एक है Mr. Rajneesh Bhatia. He's from Punjab, and he himself had reported, and उनका और भी issues था, depression and all that.
He was obese.
Yes, of course, he was obese. और डिप्रेशन में साइकोएक्टिव मेडिकेशन और GERD की मेडिकेशन, हार्निया, हियाटल हार्निया जो भी बोलते हैं ना. I think after 3 months he had posted, everything was gone. Everything, no GERD, nothing. This is one case. Second case was more severe. That was for 2 decades on PPI drugs. वो PPI drug क्या है वो शशिकांत और अरुण सर बता पाएंगे. 2 decades, and his forum name is I think Achutan. He's from Bahrain, South Indian. उसका 2 decade का जो है ना 20 साल का वो पॉकेट में दवा लेके चलता है. And he said कि within 6 months it is all gone. In fact, I don't remember exactly what he had mentioned was some GERD grade 1.5 or something, I don't know. इसमें doctors had advised some surgery also. Last stage मतलब ये था कि आप सर्जरी, माइक्रो सर्जरी जो भी करते हैं वो भी नहीं जरूरत पड़ी उसको.
Actually, yes, you continue, Anu.
Yes, ये दोनों तो जो है ना मतलब जिसको बोलते हैं from day 1 to the day they really reported that they are off all problems. बाकी बीच में केसेस थे जो लोग इम्प्रूव किए, पोस्ट करना छोड़ दिए.
And what about the Richa case? I think she was also suffering from.
Yeah. उसका तो पता नहीं कितना 25-40 हजार का तो मेडिसिन चलता था खाली GERD के लिए साल का, ठीक है.
तो उसका मेडिसिन छूट गया क्या ये GERD का?
हाँ, GERD का उसका एक तो जो some syrup she was taking that was gone. I don't remember the 2 name of drugs, Acta Pro or something. एक था वो और एक Novo something था. वो एक ड्रग तो पूरा खत्म हो गया था, एक 25% बचा था. उसके बाद उसने रिपोर्टिंग कर दिया बंद, ठीक है.
तो ठीक ही हो गया क्योंकि वो हमको मुझे याद है वो केस. वो ऐसा है कि वो 50% करके मैंने उसका डोज रिड्यूस किया. उसका एक ड्रग पूरा खत्म हो गया. दूसरा ड्रग में मैंने 50 तक लाया, फिर उसका 25% पे आया और उसका दूसरे रिपोर्ट नहीं किया. ठीक, व्हाट हैपेंड टू इट?
Actually क्या होता है ना, more people they don't sustain. This is the reason. So sustainability is important if they really want to cure something.
नहीं, and this may be another reason that वो उसका issue resolve हो गया ना. So then she don't feel to write back to the forum. But one
Yes.
thing here I'd like to mention that, as Anup also mentioned, that I have read some of the papers that GERD and diabetes, many of the cases the researchers found has been reported simultaneously. Today reported diabetes, and after 1 week the GERD is reported. So when they find that there is a correlation between the GERD and diabetes. This is one. Second thing, what author was mentioned, that prescribing PPI is further enhancing your diabetic complication and even the blood sugar level.
Yeah,
So
the
why?
PPI drugs that people are taking for acid reflux or blotting or all the digestive.
This causing this will not allow your blood sugar to stable, not allowing your blood sugar to be in normal rate. So this PPI is a major culprit. And another report says that long-term use of PPI, because I remember some members from the forum, because from the Gulf country and somewhere. So he has been 5 years on PPI, and he has a kidney issue. I told him that stop immediately PPI, otherwise your kidney issue will further go worsen. So stop it. This kidney issue and diabetes all are linked with the GERD, and if you prescribe PPI, then you will not stopping GERD also, not also diabetes. PPI क्या है? That is only reduce the acid secretion, and this causing the another problem.
It's just clearing everything that is coming. That's why it is
Yeah.
helping with the blotting also, because the gas or the acid which is created by the bacteria in the small intestine, that is also cleared with the PPI drugs.
Yeah, and then it is the cycle will go on. Then you have another infection, like H. pylori, which is very prevalent. And if H. pylori comes, then your GERD issue will be further worsen. So why to prescribe PPI? I don't know, because I've been knowing the PPI drug since last 25 years. So PPI should not be prescribed at any cost.
It's making a big business, PPI drugs.
Big business, but it is causing the patient problem, na? Diabetes and GERD both. So better
Yeah.
continue
Yes,
with the
Shashi.
low carb diet.
Other than hyperinsulinemia, please understand that GERD hyperacidity is also caused by excess carbohydrate which we are taking. The moment we go off carbohydrate, immediately the GERD acidity just goes away.
Yeah,
so
yeah.
the reasons could be many. Hyperinsulinemia, excess carbohydrate is the usual cause. Even I dumped Diagene and everything within a week. That's one thing. Other thing is the uncontrolled blood sugar itself can cause gastroparesis.
Yeah.
Gastroparesis, yeah.
Because it affects the vagus nerve. That's why.
Yeah.
So these are the three conditions which can be resolved with the low carb diet. Yeah, just
Gastroparesis will also further cause your hiatal hernia.
Yeah.
You have a pressure on the abdomen, and your muscles of the diaphragm is weakened. So lower part of your alimentary canal, lower part of esophagus and stomach will come up above
Yes.
the diaphragm. That is the problem. That is due to this problem.
And that can lead to Barrett esophagus, which in itself is not that serious, but further it can lead to the esophagus cancer as well.
Cancer, and not serious, but it is causing lot of discomfort to the patient. Lot of discomfort to the patient. So that is the all linked with each other. Carbohydrate or mainly wheat consumption, carbohydrate consumption leading to the hyperinsulinemia, and then GERD, and then hiatal hernia. These are all linked with it as per the gastro. And then if you are prescribing these drugs like PPI, which will reduce the acid, stomach acid, then further it will causing the infections in the GI tract. Maybe other small intestine infections also may cause. So this is why the low carb is the best solution for all. Yes.
Thank you, Arun Kumar. So one more point related with the digestion that I would like to add is about the gallstones. Many people, particularly the women who come to me, they also have gallstones. So the gallstones, when the people, they go for the scan. So on the scan, they mentioned that there are some stones of cholesterol and bile, some bilirubin is there, and some water molecules are there. So when people, they see cholesterol is forming or it's precipitating and getting into the stones, So they just again, they think about the high fat diets. So in such scenario, how it becomes more and more difficult for us to people, really, convince them about the high fat diet. So Shashikant Iyengar, could you tell why there are some cholesterols in the bile and why it's related to the insulin resistance?
See,
Because most of the diabetic, they are having the gallstones as well.
what has happened is the etiology is something different because of their low fat diet. So probably the bile do not come out and they are stored there, and then some small stones are already formed and they are there. And the moment we shift to a high fat diet, immediately biles are released, and during this time the bile stones are also released. So somewhere this is all related to insulin resistance, to low fat diet, and probably wrong kind of fat also. So probably that's why when we initiate into the low carb diet, probably we'll have to step up the fat intake very, very slowly. So that's how it is.
And even, they say that when the insulin levels are high, liver produce more and more cholesterol. And because this gallbladder, which is stuck to the liver, everything which is produced by the liver, it gets to the gallbladder. And at the same time, people are not eating fat, and this cholesterol, it gets into the stones because it's not being used up by the body. And even could you tell Shashi, if a person is having a high insulin and more cholesterol is formed, okay, somebody is having a gallstone, and if we switch them to the low carbohydrate diet and the high fat diet, is there any possibility, because when they start eating fat, then the gallbladder will it get compressed, and is there you have any idea that we can release those stones from the biliary duct?
See, I on this subject, I have no idea, frankly. But what I know is we need to step up the fat very, very slowly. If we just increase the fat like cold turkey, like go 60% fat, probably it can cause obstruction. But I think
particularly in the people with the gallstones,
with many of them may already be having preformed gallstones. So what we don't know, the moment the people shift to high fat diet and then people say it is caused by high fat diet, no, it is already there. So people need to realize. But how and all, maybe Arun Kumar can explain much better than me.
I think in that case, Jasmeet, we should go for the MCT. I mean, like coconut oil and all, that fat will not cause that problem with the gallstone. And as Sasi mentioned, that gallstone, see, everybody is having gallstone in small quantity, say less than 2 mm. The size of the stones are less than 2 mm. So in that case, it will be removed automatically with the bile salts is removed and go to the intestinal tract. But sometimes when gallstone is larger than 2 mm, it is difficult to go out from the this bile duct. So in that case only, we need to have this slowly, because I have one case, say, 2 years back. She was having the gallstone and she actually operated. Gallbladder also removed. And she come to me what to do now. So should I go for the high fat, low carb and high protein diet? I told him, you just adopt MCT oil. You make your all the cooking and everything in MCT coconut oil. That's why, because that is the safest way. Otherwise, in normal case, when the stone is there, I still believe, I don't know whether other is big or not, I still believe if the stone size is bigger, then it will be difficult to get, crush the stones inside the gallbladder or inside the bile duct. So in that case, you have to remove it, whether it is the endoscopy or whatever.
please, Anoop.
Yes, Anup.
You are mute.
Oh, Anup, mute.
Yeah, on forum we have one case where gallbladder is removed. ठीक है, और वो low carb पे he sustained very nicely. Yes, as Arun sir said initially, just to get acclimatized, as they say, आप MCT से चालू करो, धीरे you come down to normal fat. And as Shashi said, we in general also we do not go cold turkey कि आज से आप जो है तीनों मील जो है 60% fat, 20%. Go very gradual. आप इतने साल तो भुगत के ही आए हो ना. तो go slow. If it takes 3 weeks, 4 weeks, we are fine with it. Bas.
So the last point I would like to talk about, another thing about the insulin actually. So everybody's nowadays is doing intermittent fasting. So intermittent fasting is getting popular and everybody is seeing some kind of benefits. But actually nobody is actually aware what actually intermittent fasting is doing in their body. Here also insulin plays the major role. Intermittent fasting is done to normalize the insulin levels. So, but I want to talk not about the intermittent fasting, but about the low carbohydrate diet. Like we can mimic the similar kind of benefits from the low carbohydrate, very low carbohydrate diet by keeping us in nutritional fast. So in the nutritional fast, we actually focus on the food which doesn't spike insulin. So on the forum, we have Arun Kumar, I think Shashikant Iyengar and Anup Singh. These three of them all are doing some kind of fastings. Arun Kumar is going beyond, I think, 24-hour fast, but Anup Singh, you are doing 16-hour fast.
Maximum. I cannot tolerate more than 20.
So Shashikant Iyengar, could you talk a bit about how with the low carbohydrate diet also we can get the similar kind of benefit by keeping our insulin low, or we can extend the benefit of the fasting?
See, I think it's very simple that on a low carbohydrate diet, we are going to release less insulin. So it is as good as intermittent fasting. But if you combine low carb and intermittent fasting, then nothing like it. You are going to spike insulin only twice, and that too less. For an example, a person on high carbohydrate diet, post meal, their insulin can spike more than 70 also. If he's metabolically healthy, he or she, then 50 or 60, otherwise it will exceed 70. So if they eat 3 or 4 times, you can imagine spiking insulin like hell. So on a low carb diet, maximum my post meal insulin is just around 25-30. So if I eat 2 times, so it is just a small spike. So that's how it is.
So have you ever measured your post insulin levels?
Around 25, twice I have measured.
No. And
Okay. After
how much
high protein meal.
carbohydrates?
After a high protein meal, in fact, carbohydrate would be just around maybe 15 grams max.
15 gram per meal.
15 to 20 max. So I am between in a day 30 to 50.
So Sasi is now
Very
designed
interesting.
that.
I think since you have come to this topic of insulin, I'll just take a minute to share a slide because this will provide some clarity to everyone. Craft pattern style. So someone asked how we can identify hyperinsulinemia earlier. So it could be due to obesity, central obesity. Otherwise, if you measure your postprandial insulin, so if you see within 1 hour, it should not exceed around 60 or so. Within 2 hours, it should come to some 25-30. This is where I lay. Whereas with most of the people, it will just exceed 60, 70, 80. So these are the people who are at risk of diabetes. And someone on a very high 2 hour, more than 160, 170, they are essentially as good as diabetics. Maybe their blood sugar has not gone up, it will go up very shortly. So this Kraft pattern is something which is available in internet. They can just type Kraft pattern of insulin and they will get it. So if you are somewhere in the blue region or blue curve, will be safe, but others are not safe. And they'll be diagnosed as diabetics very shortly. Yeah, thank you.
So I think this oral glucose tolerance test is the must. I think if somebody really want to see if they have reversed their
This is above oral glucose. This is oral insulin tolerance. After giving the glucose, what is their insulin? They have to pay extra to measure it.
Yes, yes. Along with the glucose, they measure the insulin levels after 1 hour, 2 hours, and I think up to 3 hours.
Yeah.
Yeah, up to 3 hours, and it should be
even if you do for 2 hours, it is okay. I mean, even if you do for 1 after 2 hours, it is okay.
Because in many cases, I have seen that insulin level, fasting insulin levels comes normal around 6 or 7, but we never measured the post insulin levels, and that's more important.
That is true.
It's because it's expensive, and we can't ask everybody that just do this kind of test.
Yeah.
But 2 things are there, Jasmita. Not only expensive.
Cost? How much does it cost, this kind of test, if we have to measure oral glucose tolerance?
See, insulin test itself costs some 650 or something.
Yeah.
Yeah,
OGTT I have not tried, so I don't know.
OGTT, when you are doing oral insulin test, serum insulin test, then is there any need to do the OGTT?
Sorry. Could you repeat, Arun?
If you are doing for serum insulin test, fasting or TP, fasting and TP, What is the need of doing this OGTT?
See, OGTT is done to diagnose
Your glucose tolerance.
OGTT.
Glucose tolerance.
And if we do insulin, then it will give an accurate picture whether we are actually hyperinsulinemic or not. See, rather than doing this, we can ask the person to have full meal, not breakfast, not idli, poha, chutney or something. Have full meal. Even if the person takes meal at 1 o'clock and goes at 3 o'clock, it's okay. And then get the insulin done along with blood sugar.
Actually, my point is that because we never take this glucose and routinely, say taking 75 gram glucose and doing for this. Why not we should take our breakfast or lunch, whatever it is, and then go for the PP insulin?
That's what I have done.
That's the better.
That is better. We can calculate how many carbs we are taking and corresponding how much insulin is raised.
That's correct. But normally we are not taking glucose. We are every day taking this food, whatever it is, breakfast, lunch, whatever it is.
Yeah, that is slow releasing.
So every day, what is the pattern of the insulin, serum insulin? That will be judged only after your regular meal.
It will be spike in glucose, no? But with the food, it will be, slowly it will be released in the blood.
No. If you're the normal person, I'm talking like a low carb diet, normal person who is taking the dal, roti,
High carb, yes.
Just so, we are exceeding time. It is almost 5:20.
Okay.
I think we need to open up for the question and answer.
Yeah. Okay. Yes, better. So audience, if you have any query, please post, or you can just directly, come up and ask anybody if you want.
I have given the option to unmute because I think it's almost 1.5 hours almost. So if anyone has any question, they can ask because I have kept the option of unmute themselves. Because we are so enthusiastic, we can talk for 2 hours also.
Shashi, why I was talking about this oral glucose tolerance test, nowadays I have seen that many people, they are posting that they have completely reversed their diabetes using this low carb approach, and now they have also cleared this OGTT test.
So they will go and start having high carbs. So people don't realize that, but it's okay. I mean, they have to be low carb for life. It is not going to.
Yeah, because they really want to shift back to the high carb.
So they will pay a price later on.
That is the problem. People are thinking that the high carb meal is the normal meal, and we are thinking that low carb diet is a normal diet. There is a difference. So
yes, Anup.
Yeah, so I have kept the unmute option.
No, please unmute yourself.
Yeah, I think I have unmuted all. I mean, if they want, anyone can ask questions. Sorry.
Somebody has raised the hand. Girish Pasupati.
Yeah, anyone wants to ask, they can unmute themselves.
Girish Pasupati, yes. First unmute yourself.
Okay.
Yeah, Girish.
Okay, yeah, thanks. It was a great session. So my question is, so when you say low carbs, right? So the question I have is, how much is low carbs? Like, how do you, for a person, let's say my mom, 60 years, and her HbA1c recently, when I tested it, it's 6.3. So the thing is, how do I know like this much fat and this much protein and this much carbs? Is it some sort of an experiment that we have to and if that's the experiment, what sort of tests as a feedback we can take and know it's working, and at what intervals? Are there some guides where we can read up and follow this? That's all I have. Yeah.
Okay. Shashi, would you like to answer or no?
Yeah, see, what happens is, depending upon the metabolic damage, depending upon HbA1c, depending upon medication taken, we can have the carbs anywhere between 30 to 100 or even 120 for the matter, let me tell you. So that depends upon experimentation, and your blood sugar meter will actually is the best guide. So we will initially give a lower carb diet, and then if the response is well, we can slightly increase or decrease the carbohydrate. So it's an experimentation which you have to do. And we usually calculate the protein actually, and along with protein, fat will come, and we are restricting carbohydrates. So that we will depend. And we usually start with a little higher carb, and then we will start restricting also. Like probably we can give 80 to 100 gram carb. If the response is good, they can continue. If the response is not good, then we can restrict even more.
And as you mentioned that your HbA1c is 6.3, and we don't know what kind of medications you are taking at present. So with what medications you are getting 6.3, and like Arun Kumar, Anup Singh, Shashikant, the three of them, they are diabetic, but they are on the different ranges of, because they have different carb tolerance. So it depends on a person to person. So it has to be monitored, and then accordingly, finally we decide. So yes, Sunil Kumar. Sunil Kumar.
Am I audible?
Yeah.
Yeah.
Yeah. See, I've been active of late. I was working as a director with Serum Institute of India and retired about 4 years back. And I've been very active on this social media. I've been following the posts of Dr. Shashi and all, and then requested to join. I must compliment to you, Dr. Jasmeet, Dr. Anoopji, Dr. Arun, for the amazing session. Being a non-medical, but having been 40 years in the biotechnology, I read a lot, may not have implemented, but I wish this knowledge which you have shared today reaches the millions of people through all platforms, and they can see the life they can lead. Can I narrate a personal incident for 2 minutes?
Yeah.
Sure.
And before that, none of us are doctors except Jasmeet, and she's a PhD.
PhD.
And we are non-medicals. Yeah.
I'm an engineer by profession.
Oh, really? Okay. So Dr. Jasmeet PhD भी हो तब भी डॉक्टर साहब ही है जी पंजाबी में ठीक है ना अच्छा I'll tell you my incident. I have been obese for a fair amount of my life. I have not been sort of exercising a lot, active, very active. Now in 2015, I'll give you an example. In 2015, I had a grade 3 fatty liver. I was grossly obese that time, and I was also used to take alcohol quite regularly, not like alcoholic, but quite regularly. And then, I got all my FibroScan done, this, that gave me such a scare. I gave up alcohol and not even touched a drop after 7 years. Now, at that time, they did my FibroScan and they said that my KPS is over 21 and my CAP score was 400, right? I brought my weight down. I gave up non-veg in the last about 7 years. And then my KPA came down to a level of 10. 21 was cirrhosis, right? Now, at 10, it means it is a F2 fibrosis. It's really proved that a low carbohydrate diet coupled with exercise can do amazing results. My only apprehension has been that since I had a fatty liver, would a low carb and a high fat diet create trouble for me, or it can do some wonders to my body? That's what.
Yes, Anup. Yes,
Yeah.
Anup.
Let me quote one case. 10.8.
I'm not diabetic. I'm only hypertensive. I'm 64, very active otherwise. And
Okay.
I have been consulting doctors, but I'm still caught up in the web that I have, and once I lose my weight, I do everything, the thing come down, again, slight gain in weight, again it goes up. I need to know where I'm faulting. My SGOT, SGPT, all is correct, Bas, this is what I want to say.
Check insulin.
Acha.
Fasting
Okay.
and PP.
Okay, I've checked my HbA1c and all has been correct. I'm non-diabetic, but I'll check this. Yes, can I have some guidance and then I can consult?
Anup would like to say something.
Yeah, there's one.
You're not there on the social media. Try to check up about your availability, where you are. It's just
Not
so
much, not much. I don't get much time for this social.
No, not that. How do somebody reaches you out professionally?
I am there at D-Life.
Where?
I'm there at D-Life.
DLife.in.
DLife.in.
DLife.in. Okay, yeah. I'll check up. Then because I checked up, it shows only about your LinkedIn profile, which I'm not there. Anyhow, sorry, I'm over now. Can I hear it now?
Yeah. Anup Singh would like to add something to your question.
There's one case, 10.8 kPa to 5.6 in roughly around 4 months. His IRQ came down to normal, and he was on shifted from, and he was, taking alcohol just like you. But his numbers came down to near normal from 10.8 kPa, which now you know what it means. to 5.6 when he last reported. And it took around 4 months for him to achieve this result. So low carb, high fat does not cause fatty liver. The problem is people, if they start taking a lot of ghee along with parathas and rotis and, aloo dums, then yes, it is a big problem. So avoid, or I would say limit carbohydrate to, our definition of low carb is 100 grams max. Anything below that is perfectly fine if it is controlling your blood sugar and other parameters.
How do I go about it professionally? In terms of being right, how can I get the information? How do I go about professionally?
Neil, that Shashi already mentioned, you first go and check your insulin levels. Insulin is very important here because insulin dictates your liver cells what to do with the energy which is coming in, either to store it as a fat or not.
What exactly Mr. Sunil wants to know? You mean professional consultation?
A consultation on the nutrition point of view, how to go forward. I don't drink alcohol. For the last 7 years, I don't touch alcohol at all. I've given up.
Then you can register with us at dlife.in. That would be better, I think.
I'll do that.
Yeah. And if you want, you can ask for anyone to be assigned as a nutritionist. So
because me, Shashikant Iyengar and Arun Kumar, we also deal personally. But if you would like to have a collaborative kind of help, then you can just register at dlife.in.
Yeah. I'll do that. And I would like to move on because I am very serious. I'm 64 and I would like that I keep my health well,
You are too young, sir. Don't worry. You are not 64. You are too young. And one more thing I would like to add here. Since you had a fatty liver, please don't touch any fructose. Fructose, any sugar, any cold drink or any.
You must be having high uric acid as well, I think.
No, that's okay, ma'am. There's no problem in that. And if I take, I don't take juices, I don't take cold drink. The only thing is I take, once in a while, I take Diet Coke. If I want to take that also, I'll give it up.
Diet Coke is not good, sir. Diet Coke is no good. It's a selling gimmick of this year that contains something artificial sweetener that may harm otherwise.
Actually, Arun, it's very difficult to, convince people about the Diet Coke because it's written 0 carbs, 0 sugar, everything.
No, but it is written what type of sweetener they are mentioning.
Yeah.
And that sweetener, what they are doing this. So they should understand that. Okay, you join D-Life, and in D-Life, we all will be there. We'll just, whatever questions we are, we'll sort out.
I can share my reports and I'll move on, because doctor told me
you
take your vitamin E.
Register.
I'll do that, sure.
Thank you.
Okay.
Thank you.
I think Nick is having a question now.
Any other question? Nick, yeah.
Yes, I've got a comment, and inspired by Sunil. The Diet Coke, and you can also look at me. The Diet Coke, it might be 0 sugar or 0 calories, but the fact of the sweetness in your mouth, you have to see me. You can't see me. No, never mind. The sweetness in your mouth, that immediately increases your insulin because your body thinks there's something sweet, so now I have to get ready to produce some insulin to combat the blood sugar that's going to rise. It's the body's actually quite clever in that respect.
Yeah.
And the other thing I wanted to say, the other thing I wanted to say was, thank you very much. I think it's been very, very interesting, and I didn't understand all of it, but I know a lot of it from beforehand. But I think it's fundamental to tell people, the continent of India, there's so many people before they become metabolically sick to try and do something about limiting they don't get sick with overweight and pot belly and the blood pressure and pre-diabetes leading on to diabetes, Alzheimer's and dementia, like you said. So I think it's, being more active from an earlier stage, it's easier than when you become medicated, and then it's really difficult, isn't it, to change.
Yeah, actually, Nick, what is happening is I have seen many people, even they are following the healthy lifestyle, low carb or ketogenic, still they are craving for sugars. You know why it is? Because they are still missing some essential fatty acids and amino acids in their diet. So if they daily, they just focus on their diet, slowly the cravings will definitely go. And I think the glutamine also help with such kind of cravings. But first look into your diet.
Yes, correct.
And add some salt also, extra salt.
Yeah,
Because
salt is very important.
lack of sodium will also give you carving for the sweetness, sweet things.
Yeah. In most of the people, with just the salt, all the sugar cravings just goes away.
Yeah.
Mm.
Okay.
Nick, I just want to hear something Hindi from you.
Dhanyavad today. It's very good. Bahut acha na?
Bahut acha.
Dhanyavad.
Thanks for joining.
Dhanyavad.
So I think no more questions from the audience.
Yeah.
Okay, so thank you so much everybody for joining us, and thank you Sushi, thank you Anup, and thank you Arun Kumar. So the main aim of doing this episode is we just want people to think about insulin whenever they, even if they are suffering from any kind of metabolic issue. First look into your insulin levels. If fasting insulin is correct, then go for the PP insulin test and talk to your doctor about that. So how to normalize your insulin levels? So yes, Anup.
Yes, since it is about insulin now, let us first tell what is the correct insulin level, because lab का range जो है वो 25
Yes, very important point, Anup.
तो जो भी lab का test करे, fasting insulin, if it is 6 and below, you are good. 6 to 8 or 9 like me, compromise above 9, you are driving on a dangerous road. पहला तो ये है. दूसरा, इंसुलिन का टेस्ट कोई भी डॉक्टर बोलेगा नहीं. No doctor will ever tell you or recommend insulin measurement, because of one reason: there is no patented drug, there is no patented injection which can get that insulin level down. Now, only thing that can help is diet correction, and in diet correction, it is low carb or keto. That's all.
Yeah.
Thank you.
And another thing is, when you measure your insulin level, also measure your glucose and HbA1c. So just see that if your HbA1c is 5.2 or 5.6 or even up to 6, and if your insulin level is 20, so you see how much your body is, working hard to keep that normal blood sugar levels. It's very important. So do all of them all together.
Yes, yes.
Thank you.
With 12 hours fasting, ma'am?
Yeah, fasting. First take fasting, then PP will give a better picture.
12 hours fasting?
Yeah.
10 to 12 hours. 10 to 12 hours.
See, when you're saying to get out these sweeteners, you increase your salt intake. But people who are hypertensive, we avoid. Like, I don't put table salt. I'm hypertensive. I'm not diabetic. And I don't have a craving for sugar. But still, to remove it, if I add salt, then my concern is that we are using this Senda rock salt. So increasing the salt should not increase your hypertension levels.
Actually, Shashi, he already mentioned, because this, if you have high insulin levels, definitely your kidneys will not, they will retain more salt and your blood pressure will rise. So first normalize your insulin levels and see if that is the main reason of your high blood pressure.
I got your point.
Yeah.
Thank you. Thank you. It was an amazing session. I must thank personally everybody. I learned so much today in a very simple language, and it's really amazing. I wish I could reach out a lot of people more and tell them about this, and I'll revert, definitely revert.
You're most welcome.
Thanks a lot.
Okay. Thank you so much, everybody.
Thank you. Bye.